Why does Ewing sarcoma recur after initial treatment? Imagine fighting a battle against a very aggressive form of bone cancer. Even after undergoing intense treatment, sometimes the cancer comes back. Why does this happen? Ewing sarcoma is a type of cancer that often starts in the bones or soft tissues, mainly affecting children and young adults. It is known for its biological aggressiveness and ability to spread quickly. One main reason for recurrence is that some cancer cells survive the initial treatment. When doctors give chemotherapy before surgery, they look for a high percentage of tumor cell death, called necrosis. If less than 90 to 95% of the tumor cells die, there's a higher chance that some cancer cells remain. These residual cells can later grow back, leading to a recurrence. Sometimes, the tumor shrinks only a little during treatment, which also suggests that some cancer cells are resistant to the chemotherapy. This resistance allows the disease to persist and eventually relapse. The location of the tumor plays a role too. Tumors in the pelvis are harder to remove completely because of their position. If surgery doesn't get all the cancerous tissue, or if the margins are not clear, the risk of local recurrence increases. Adding radiation therapy can help improve local control by targeting remaining cancer cells, but it does not always eliminate all resistant cells. Patients who initially have cancer that has spread beyond the primary site, known as metastatic disease, are more likely to experience recurrence. These cases often see the cancer come back in distant parts of the body like the lungs or other bones. Studies show that the recurrence rate in metastatic cases can be as high as 50 to 80%, compared to about 25% in cases where the cancer was localized at first. Most recurrences happen within the first 2 years after treatment, which is called early relapse. These early relapses tend to have worse outcomes. The cancer often returns in the lungs or other distant sites, but sometimes it can come back at the original tumor site, especially if the initial removal was incomplete. Ewing sarcoma is biologically very aggressive. It can contain resistant cancer cell populations that survive even the most intensive treatments. These resistant cells can cause the cancer to come back months or years later. The tumor's microenvironment and genetic makeup also influence how likely it is to recur, but scientists are still researching these factors. Despite the best available treatments, including chemotherapy, surgery, and radiation, some cancer cells evade eradication. Currently, there is no standard cure for recurrent Ewing sarcoma, which makes preventing recurrence challenging. The key to reducing the risk of relapse is to respond well to initial therapy, achieve complete tumor removal when possible, and carefully monitor patients after treatment. Ongoing research aims to better understand the biology of Ewing sarcoma and develop new therapies to prevent and treat recurrence. If you or someone you know is affected, it is essential to work closely with oncology specialists to explore the best personalized treatment options.